When a patient requires mechanical ventilation, the first question is often how we access the airway. An endotracheal tube is the standard choice for emergency or short-term support, typically inserted through the mouth. But how does this differ from a surgical tracheostomy, and why would we switch? Let's break down the mechanical differences between these two life-saving tools.
The ET tube passes through the vocal cords, which can cause irritation or damage if left in place for too long. In contrast, a tracheostomy involves a surgical opening directly into the next trachea, bypassing the upper airway entirely. This shift is usually considered after 1 to 2 weeks of ventilation to improve patient comfort and safety. It provides a more stable and direct path for oxygen to reach the lungs. As nurses, our primary focus is maintaining a patent airway and preventing complications like accidental decannulation or infection. Both methods provide a direct route for ventilator support and require diligent suctioning and skin care. Ultimately, the goal remains the same, ensuring safe airway management and effective ventilation for our patients. Remember, the choice of device depends on the expected duration of respiratory failure.